What if I told you that one tiny clove of garlic, eaten raw, right before bed, could lower your blood pressure by 10, 15, even 20 points overnight? You'd probably think I'm exaggerating. But I'm not. And tonight, I'm going to show you exactly what happens inside your arteries in the 12 hours after you eat that one clove of garlic. My name is Dr. James Carter. I've been a practicing physician for over 22 years. And high blood pressure, hypertension, is the single most common condition I see in patients over 60. It's called the silent killer. And for a very good reason. You can't feel high blood pressure. You can't see it. You won't know it's there until something goes wrong. Until you have a stroke. Until your kidneys start failing. Until your heart gives out. And every day that blood pressure stays elevated, the damage is accumulating. Silently. Now, most doctors will hand you a prescription. Amlodipine. Lisinopril. Losartan. And yes, sometimes, medication is absolutely necessary. I prescribe it myself. But what most doctors won't tell you is that there is a natural compound, used for over 5,000 years, that works on the same biological pathways as those medications. It reduces inflammation. It dilates your arteries. It thins your blood naturally. And it costs less than $1. Stay with me until the end. Because I'm also going to reveal the number one mistake that people make when eating garlic, and it completely wipes out all the benefits. Most people do this wrong every single time. First, let me explain what high blood pressure actually does to your body. Because most people don't truly understand the damage that's happening right now, every hour, every day. Imagine your arteries as garden hoses. When you're young, those hoses are soft, flexible, and wide. Water flows through them easily, with no resistance. But as we age, especially after 60, those hoses begin to change. The walls thicken. The tissue becomes stiffer. And something called atherosclerosis begins. Plaque, made of cholesterol, calcium, and inflammatory cells, starts building up inside the artery walls. Now your heart has to push the same amount of blood through narrower, stiffer tubes. The pressure inside those tubes rises. And that elevated pressure causes damage in 5 critical ways. Number 1, your endothelium. The endothelium is the ultra-thin inner lining of your arteries. It is only 1 cell thick. And it is extremely sensitive to pressure. When blood pressure is too high, it physically tears and damages these cells. And once the endothelium is damaged, inflammation sets in. Plaque accelerates. The cycle gets worse. Number 2, your heart muscle. When your heart has to push against high resistance, every single beat, it has to work harder. Over time, the left ventricle, the main pumping chamber, thickens and enlarges. This is called left ventricular hypertrophy. And it dramatically increases your risk of heart failure. Number 3, your kidneys. Your kidneys contain millions of tiny filtering units called nephrons. Each nephron has a tiny ball of capillaries called a glomerulus. High blood pressure crushes these tiny vessels. They scar. They stop filtering. Kidney function declines. In fact, high blood pressure is the second leading cause of kidney failure in the United States, right after diabetes. Number 4, your brain. Every point your systolic pressure rises above 120, increases your stroke risk. High blood pressure also damages the small blood vessels in your brain, over time, leading to what doctors call white matter lesions, areas of damaged brain tissue that contribute to memory loss, cognitive decline, and dementia. Number 5, your eyes. The tiny blood vessels in your retina are some of the most pressure sensitive in your body. Chronic high blood pressure damages them, leading to hypertensive retinopathy, blurred vision, and in severe cases, blindness. Now, here's the critical piece that most people don't know. Blood pressure follows a daily rhythm called a circadian pattern. It is supposed to rise in the morning when you wake up. This is normal. And it is supposed to drop at night when you sleep. This is called the nocturnal dip. Your body needs that nocturnal dip. It's when your heart rests. It's when your arteries recover. It's when your body repairs the damage from the day. But in people with hypertension, especially seniors, that nocturnal dip often disappears. Blood pressure stays high all night long. And that's when the most serious cardiovascular damage accumulates. This is exactly why what you do before bed matters so much. And this is exactly why garlic, taken at night, is so powerful. Now let's talk about the science. And I want to be very specific here, because the mechanism behind garlic's cardiovascular effects is genuinely remarkable. The active compound in garlic is called allicin. But here is something most people don't know. Allicin doesn't actually exist in a whole garlic clove. Let me say that again. Allicin does not exist in intact garlic. Instead, garlic contains two separate compounds: a lion, a sulfur-containing amino acid, and an enzyme called allinase. These two compounds are stored in separate compartments inside the garlic cell. When you crush, chew, or cut the garlic clove, you break those compartments open. A lion and allinase come into contact. A rapid chemical reaction occurs. And allicin is formed right there, in that moment. This is why crushing garlic is not optional. It's the entire mechanism. Now, once allicin enters your bloodstream, it works through three powerful pathways. Pathway 1, nitric oxide production. Allicin stimulates endothelial cells, those same cells lining your artery walls, to produce nitric oxide. Nitric oxide is a vasodilator. It causes the smooth muscle surrounding your arteries to relax. When the muscle relaxes, the artery widens. When the artery widens, blood flows with less resistance. Blood pressure drops. This is the same mechanism used by a class of drugs called calcium channel blockers, like amlodipine. The difference is that garlic achieves this through a natural, biological pathway, with no side effects. Pathway 2, ACE inhibition. ACE stands for angiotensin converting enzyme. This enzyme produces a hormone called angiotensin II, which causes your arteries to constrict and your blood pressure to rise. Allicin inhibits ACE activity. It literally blocks the enzyme that raises your blood pressure. Now, you may recognize ACE inhibitors from your medication cabinet. Lisinopril, ramipril, enalapril. These are all ACE inhibitor drugs. Garlic's allicin works on the same enzymatic pathway, naturally. A 2016 study in the journal Integrated Blood Pressure Control found that garlic extract reduced ACE activity by up to 30% in hypertensive patients. Pathway 3, antiplatelet and anti-inflammatory action. Allicin reduces the stickiness of platelets, the tiny blood cells responsible for clotting. When platelets are less sticky, the risk of a blood clot forming inside a narrowed artery, which is exactly what causes a heart attack or stroke, is significantly reduced. Additionally, allicin suppresses a molecule called NF-κB, the master switch for inflammation in your body. Chronic arterial inflammation is the root cause of atherosclerosis. By reducing NF-κB activity, garlic directly attacks the underlying cause of high blood pressure, not just the symptom. The research is substantial. A meta-analysis, published in the Journal of Nutrition, reviewed 12 randomized controlled trials involving 553 hypertensive patients. The conclusion: garlic supplementation reduced systolic blood pressure by an average of 8.7 mm of mercury and diastolic by 6.1 mm of mercury. To put that in perspective, that is comparable to the effect of a first-line antihypertensive medication from 1 clove of garlic per night. Now let me give you the exact protocol. Step by step. Write this down or screenshot this right now. And before I do, I need to tell you the number one mistake. The one I promised you at the beginning. The mistake is cooking the garlic. I know. Most people cook garlic. It's in every pasta sauce, every stir fry, every roasted vegetable dish. And yes, cooked garlic still has some benefits. It still contains antioxidants. It's still anti-inflammatory. But the allicin, the compound responsible for lowering blood pressure, is completely destroyed by heat. Here's why: allinase, the enzyme that converts a lion into allicin, is destroyed at temperatures above 60 degrees Celsius. That's 140 degrees Fahrenheit. The moment garlic hits a hot pan, within 60 seconds, the allinase is gone. And without allinase, no allicin can form. A study from Pennsylvania State University confirmed this. Sautéed garlic produced 0 allicin. 0. So the rule is absolute. For blood pressure benefits, garlic must be eaten raw. Now, here is the complete protocol. Step 1. Choose the right garlic. Use fresh, whole garlic bulbs. Not pre-minced garlic in jars, those are often treated with citric acid and have reduced allicin potential. Not garlic powder. Not garlic salt. Fresh bulbs only. Choose cloves that are firm, plump, and not sprouting. Sprouted garlic has lower allicin content. Step 2. Peel 1 medium clove. 1 clove. Not a whole bulb. 1 clove contains approximately 5 to 9 milligrams of allicin, which is the therapeutic dose established in clinical research. Step 3. Crush it, don't slice it. Place the clove under the flat of a knife and press firmly until it cracks and flattens. This mechanical action breaks the cell walls and initiates the alliin-allinase reaction. Slicing is less effective. Crushing is best. Chewing thoroughly also works, but the smell is more intense. Step 4. Wait exactly 10 minutes. This is critical and most people skip this step. After crushing, you must wait 10 minutes before eating the garlic. This waiting period allows the allicin formation reaction to complete fully. Research shows that eating garlic immediately after crushing produces significantly less allicin than waiting 10 minutes. Set a timer. 10 minutes. Every time. Step 5. Eat it raw, right before bed. You can swallow the crushed clove whole, like a small pill, with a glass of water. This minimizes the taste and breath impact. Or you can mix it into 1 teaspoon of raw honey. Raw honey coats the garlic and significantly reduces the intensity. It also adds prebiotic benefits for your gut. Or mix it into a tablespoon of plain yogurt. Step 6. Drink 1 full glass of room temperature water immediately after. This helps move the garlic into your digestive system quickly and reduces reflux risk. Bonus step: if garlic breath is a concern, chew 5 to 6 fresh parsley leaves immediately after. Chlorophyll in parsley neutralizes the sulfur compounds responsible for garlic odor within minutes. Do this every single night. Consistency is everything. 1 night of garlic does little. 30 consecutive nights changes your cardiovascular health. Now, garlic is powerful. But it works even better when combined with other evidence-based foods that support cardiovascular health. Let me give you 4 additional foods that I recommend alongside the garlic protocol. Food 1. Beetroot. Beetroot, or beet juice, contains high concentrations of dietary nitrates. When you consume dietary nitrates, your body converts them into nitric oxide, the same vasodilating compound that garlic stimulates. A study from Queen Mary University of London found that drinking 1 glass of beet juice per day reduced blood pressure by an average of 8 millimeters of mercury within 24 hours. That is a remarkable result for a single food. Have half a cup of cooked beetroot with dinner, or drink 200 milliliters of pure beetroot juice with no added sugar. Food 2. Hibiscus tea. Hibiscus contains anthocyanins, powerful antioxidant compounds that inhibit ACE activity, just like garlic. Multiple studies have shown hibiscus tea reduces systolic blood pressure by 6 to 10 millimeters of mercury in hypertensive patients. Drink 1 cup of hibiscus tea in the afternoon, about 3 to 4 hours before your bedtime. Garlic. Food 3. Dark leafy greens. Spinach, kale, Swiss chard, these are loaded with potassium and magnesium. Both minerals are critical for blood pressure regulation. Potassium counteracts the blood pressure raising effect of sodium. Magnesium relaxes blood vessel walls directly. Most seniors over 60 are deficient in both, because absorption decreases with age and many blood pressure medications deplete these minerals further. Aim for 2 cups of dark leafy greens daily, raw or lightly steamed. Food 4. Pomegranate. Pomegranate is one of the most studied fruits for cardiovascular health. It contains punicolagens, compounds that increase nitric oxide production and reduce oxidative stress in artery walls. A clinical trial published in Plant Foods for Human Nutrition found that drinking 150 milliliters of pomegranate juice daily for 2 weeks reduced systolic blood pressure by 5 millimeters of mercury. Half a pomegranate with breakfast, or 150 milliliters of pure juice, no sugar added. Now, when you combine the bedtime garlic protocol with these 4 foods consistently, you are attacking high blood pressure from 4 different biological angles simultaneously. Nitric oxide from 2 directions. ACE inhibition from 2 directions. Reduced inflammation. Improved mineral balance. This is what I call a food-first cardiovascular protocol. And for mild to moderate hypertension, in seniors, the results can be truly remarkable. Now, as a physician, I must give you the warnings. Your safety is always the priority. Do not follow this protocol without consulting your doctor if you are in any of these categories. Blood thinners, if you take warfarin, Coumadin, Xarelto, Eliquis, Plavix, or daily aspirin therapy, garlic has significant anticoagulant properties. Combining it with these medications can dangerously increase your bleeding risk. This is not a minor interaction. Please speak with your doctor first. Surgery, stop all raw garlic at least 14 days before any surgical procedure. Garlic affects platelet function and can cause excessive bleeding during surgery. Tell your anesthesiologist if you have been eating raw garlic regularly. Acid reflux or GERD, raw garlic is acidic and pungent. In people with gastroesophageal reflux disease, it can trigger severe heartburn, especially when eaten right before lying down. If you have reflux, try the garlic earlier, in the evening, 2 hours before bed, with food. Diabetes medications, garlic can mildly lower blood sugar. If you take metformin, insulin, or sulfonylureas, monitor your blood sugar more carefully when adding raw garlic. Low blood pressure, if your blood pressure is already on the lower side, below 160, garlic may lower it further. Monitor carefully. HIV medications, if you take sequinavir, garlic significantly reduces its blood concentration and effectiveness. Most importantly, if you are currently on blood pressure medication, do not stop taking it to try garlic. Talk to your doctor. Use garlic alongside your treatment. Over time, as your numbers improve, your doctor may be able to reduce your dosage. But that must be their decision. So, what can you realistically expect when you follow this protocol? Let me walk you through what I've observed in my patients who committed to 30 days of the bedtime garlic method. Days 1 to 3, most people notice improved sleep quality within the first few nights. Garlic improves peripheral circulation, your hands and feet feel warmer. Some people notice a slight reduction in nighttime bathroom trips, because better circulation means your kidneys are filtering more efficiently during the day. Days 4 to 7. If you're monitoring blood pressure at home, start checking it every morning before breakfast. You should begin to see the first measurable drops, typically 3 to 5 points systolic, in the first week. Your resting heart rate may also begin to drop slightly. This is a good sign. It means your heart is working more efficiently, with less resistance. Days 8 to 14. This is where most people see the most dramatic changes. By the end of week 2, my patients typically report drops of 8 to 12 points systolic. Headaches in the morning, which many hypertensive seniors experience, begin to reduce. Energy levels improve. Mental clarity improves. Days 15 to 30, full cardiovascular benefits are now active. Arterial inflammation is reduced. Nitric oxide production is elevated. Platelet function is optimized. Blood pressure readings are consistently lower. Many of my patients at this point return to their doctor and, for the first time in years, their doctor considers reducing their medication dosage. That moment, when a patient can reduce their medication because their body is healing naturally, that is why I do this work. I want to leave you with this. Your blood pressure did not get high overnight. It happened slowly, over years. And it will not normalize overnight either. But every single night that you eat that one raw clove of garlic, you are taking a real, measurable step toward a healthier heart, a cleaner artery, a longer, better life. 1 clove. Raw. Crushed. Wait 10 minutes. Eat it. Every night. It costs nothing. It takes 30 seconds. And the science behind it is as solid as any prescription on the market. Your heart has been working for you every second of every day of your life. Tonight, give it something back. If this video helped you, please hit the subscribe button and the notification bell right now. I upload 4 new videos every week, all designed to give you the real, science-based health information that your doctor might not have time to share. And leave a comment below with the word garlic, and I will personally send you my free PDF guide, The Complete Senior Blood Pressure Protocol, with the full garlic method, the 4 supporting foods, a 30-day tracking chart, and 3 additional natural remedies. I read every single comment. Thank you for watching. Take care of your heart. I will see you in the next video.